Shelley, Hymel. I'm in the Faculty of Education at the University of British Columbia. In the last 5 years, there have been quite a few reviews of the anti-bullying programs that are available, and they've painted a very somewhat disappointing picture. We know from the research that some programs can actually reduce bullying by 40 or 50%, which is still not 100%, so we could do better. But those are, well-designed programs and well-evaluated. But many of the studies that have shown that once you put these programs into schools, and we're not doing supported model programs, that the actual impact is more somewhere between 17 and 23%. And in some cases, the effects are more about kids' attitudes and beliefs than actual behaviors. My take on this, and it's always a work in progress, is that I think we've been looking for a simple solution. We're looking for a single program. And I don't think one exists, because I think bullying happens for a number of different reasons and therefore requires a number of different solutions. As PREVNet argues, it needs a relationship solution, but that can be a very different thing. So in trying to understand that, I look at 3 areas of research. One is clinical psychology. How much is bullying part of mental health? Are kids who bully really what they might call budding psychopaths that are willing to do it? Because we know from research that these kids show some of the traits of psychopaths: impulsivity, narcissism, lack of empathy for victims. And what we find in some research is that children who do show these characteristics, or some studies out of Greece, do have a higher risk for bullying, but it's a very small portion of the population. And so although mental health problems and things like psychopathy can certainly impact bullying for some kids, it's a minimal amount. But if that is what you have, a child who's showing the tendencies towards psychopathy, you really need to do something that it links it to mental health. These kids can learn socially acceptable ways to behave, regardless of biological underpinnings. Because Kevin Dutton has research showing that psychopaths are among us. There are CEOs, there are lawyers. They have good qualities as well and contribute to society in certain ways. So that's one thing. But at the same time, psychopathy is like less than 1% of the adult population. So what we have in many schools is when you ask kids, do you bully others, we'll get well over 50% telling us that they bully others on occasion. So it can't account for all the bullying that we see. I believe that partly bullying is part of growing up. These are kids who have, we know that bullying reaches a peak somewhere around grades 8 to 10, and that's true sort of worldwide. And it drops off towards the end of high school. It never goes away, so it's always present. And what I struggled with was why it reaches a peak at that age group. And what I realized looking at research on developmental psychology is by the time kids reach the end of elementary school, they actually have all the skills to bully. They understand perspective taking, they know how to get under somebody's skin, they know how to communicate, they have all these skills that allow them the capacity for bullying. But there's 3 areas that are not very well developed until later in high school. One is brain development. We now know that the frontal lobe of the brain, the part right behind the forehead, the CEO of the brain that puts together all the information and comes up with a good solution, that starts developing around puberty and ends around 25 to 28. So the brains of adolescents I talk about it as not fully operational, and they're just developing the capacity to figure out what is the best thing I can do in this situation. And the second area that happens developmentally is by the end of elementary school, kids are going through a period of identity development. They're trying to figure out who they are and how they fit in, and some of them will stumble across power issues and bullying, and it works, sadly. And so they will jump on that because it's very effective in getting them what they want. A third thing, though, that I think also contributes is moral development. So we know that human beings have been classified as having 3 major stages of moral development: pre-conventional, conventional, and post-conventional. And most of us adults are post-conventional wannabes. Gandhi, Mother Teresa, they're really in there. But a lot of us 85% of North American adults are in the conventional level of moral development, where we get it. We understand that we live in a society, there's give and take, and we all have to do our part, or there's chaos. You go to a 4-way stop, and if everybody doesn't stop, there's going to be a wreck. Well, kids don't get that, because all the way up through high school, the majority of kids are actually in the pre-conventional level of moral development, and that means they're looking out for number 1. They're trying to see what works for them. So I think developmentally we know that kids have the skills to bully, and yet some of the restrictions come a little bit later. So I think that also contributes. And then finally, I think that we know that bullying drops during the end of high school, but it never goes away. There's bullying in the workplace, there's bullying among adults. And so is it something about human nature? What happens to humans? We know, for example, that bullying is a group phenomenon. We know from the research by Deb Pepler and Wendy Craig that in any bullying situation, 85 to 88% of the time, other kids are present. On average, 2 to 4 kids are witnesses. And we also know that they don't often do anything to help kids that are being bullied. In fact, they're more likely to help the child being bullied than the child being bullied. And so as a group phenomenon, I started looking at what is it about group phenomenon in humans. So looking at social psychology, we know that when you put humans into groups, and I use work by Judith Rich Harris on how groups socialize individuals, as soon as you put humans into groups, different things start happening. So one thing that happens is if there is multiple groups, group contrasts get enhanced. So you start favoring your group against the other group. And if you don't believe me, go to a hockey game. You'll get the idea very quickly. And so that's some of the bullying that I see is in-group, out-group kind of fighting going on. Another thing that happens when you put human beings in a group of any age is that we tend to choose our groups, and as we do choose our groups, over time we become more similar to the group. Some of the bullying that we see is kids sort of normalizing, getting you to go along with what the norms of the group or the expectations of the group are. And then finally, when we put humans of any age into groups, we are hierarchical, we do social comparisons, we develop hierarchies, and sometimes bullying is the higher person on the hierarchy protecting their spot, so to speak. So when you ask me about climate, I think kids bully for a lot of different reasons, and it leads to a lot of different kinds of interventions, and I think we have to start recognizing that. There is no one solution. And because of the human processes, group processes that I talked about, that brings us to the idea that we not only have to work on the individual, especially if the child has mental health tendencies that contribute, but we also have to work on creating a climate where some of these natural tendencies are, if you will, thwarted and stopped so that kids will not be bullying. It is possible to create communities in schools where bullying is not tolerated and kids are in fact kind of working with each other or working among themselves to try to contribute to it. I think then you have to think about bullying as a part of a larger social issue, and that's social development of children and what they call social emotional learning in children. And what we know, as I mentioned earlier, social development is a very slow process. It happens during the time kids are in school, and probably because of the things that happen in schools. And we know from other research, not focused specifically on bullying, that the more we actually can give kids lessons and training in social emotional development, formal kinds of things that we integrate, the more positive their behavior is and the less negative it is. And there's sort of two components to that as popularized by a group in the United States called CASEL, the Collaborative for Academic, Social, and Emotional Learning. And what they've demonstrated quite strikingly is that kids who are involved in social emotional learning programs, which involve both creating a safe and caring school environment and direct training in social and emotional skills, show not only positive behaviors and less risk-taking and less negative behavior, but also improvements in academic achievement, so that we're also finding this is fundamental to academic success as well as social success. So creating that positive environment not only gives kids the skills that they need to come away with positive rather than negative social behaviors, but also creates an environment where kids are free to report bullying, to get support from bystanders or upstanders, as we now like to refer to them, and create a much better climate for kids in schools.